Hi, my name is Dr. Abdul Sekam, and I will be chairing this session of coffee and water. Today, we're going to be discussing hydrotherapy and its use in wound care. I'm joined by Jennifer T, Sergio Giannassini, and Rob Canfer. Jennifer, can you introduce yourself?
Sure. Thank you, Abdul. My name is Dr. Jennifer T. I'm from the USA. I'm a wound care nurse practitioner. I love wound care so much, and I'm very interested in knowing more about hydrotherapy because, it's for the last 15 years, we're not using hydrotherapy, and I want to reintroduce this in the US.
Over to you, Rob.
So my name's Rob Camper. I'm a physiotherapist with musculoskeletal and sports in the UK. My interest within this topic is particularly around the use of within exercise as medicine and public health, and ways to combat the development of some of the risk factors that can contribute to venous disease, and so that's where my interest comes into this debate.
And over to you, Sergio.
And hello, everybody. I'm Sergio Giannassini from the University of Ferrara, and I'm delighted to be here today. And I'd like to deeply thank all the fantastic Lindsay Leg Club. In particular, I'd like to thank Abdul for hosting this coffee and water. Indeed, I have my coffee ready, and I can't wait to learn more about what Jennifer considers risk factors for this disease, because in this session, we will be talking about how we can counteract at least one of these risk factors, which is gravity. So Jennifer, let us know what the risk factors for this disease are, and we will brainstorm in the next 20 minutes on how we can eventually counteract the gravity one.
Thank you, Sergio. As you said, the first risk factor will be gravity, and followed by genetics, which is the primary risk factor. And the second one would be, women are 50% likely to get these vein diseases, pregnancy, obesity, age, medical history, and lastly, occupation that involves sitting and standing for long periods of time.
So I think this is, as we said, an interesting format proposed by our friend Abdul in terms of enjoying a coffee in a very friendly way, but at the same time digging into the evidence-based data. So you were saying before, Jennifer, that you are extremely interested in hydrotherapy, and I'm interested in that as well, because whatever you do to these veins, recurrence, as we know, is extremely high, mainly because we pay a price for the Darwinian evolution from quadrupeds to bipeds. So this gravity force is indeed leading to having varicose veins on our lower limbs. It's very difficult to find varicose veins on our arms, if you think about that. And for this reason, there is a call to action that was already made in 2014, showing how the aquatic environment that has the benefit of removing the gravity, of course, because of the buoyancy, has been extensively used in the musculoskeletal system, for which we have Rob with us. But in terms of varicose veins, there are very limited studies on the topic. And thanks also to Dr. Erika Menegatti, who is a wonderful PhD working with me. We have been passionate about this topic for now some years, and I look forward for going on with the discussion today, enjoying our coffee, and of course to be in person together soon in our site where we are enjoying hydrotherapy. Also because we should talk maybe with Rob about the implications of water in terms of anti-inflammatory actions that has been indeed used as an application after trauma in the musculoskeletal system. And that could be used also in the venous and lymphatic disease. So Rob, what is your perspective on this hydrotherapy topic?
As you mentioned, thank you, Sergio. So as you mentioned, yes, particularly in the kind of musculoskeletal world after an acute injury, where there's swelling in and around a joint or a limb, as you said, using and where there's going to have to be pain, and as you said, gravity and an unwillingness to put load or weight through a joint. The use of hydrotherapy and water can be a really effective way of helping to facilitate some of that movement, support some of that movement because of taking gravity away. you mentioned, pressure of the water also can then help to alleviate some of the swelling and help also to restore some of the movement as we've eliminated gravity and there's more support throughout the joint. This can have an effect on helping to stimulate the healing process and help to speed along that early recovery period, which otherwise sometimes can be limited if in a ground or in a land-based setting.
Because indeed you touched interesting points, Rob, because there are physical properties of the water, which is the pressure this is creating. And all the audience who is following us should know that every single centimeter of water is creating 0.7 millimeter mercury, which means that when we are standing up in a pool, simply standing, so even if you don't like swimming, you just need to enjoy a nice coffee like we are doing today, eventually, or a drink by the pool, staying inside the pool, standing up, not even moving, and you will be already enjoying up to 80 millimeter mercury. Now, the thing that is interesting, that we will discuss with Jennifer later on, is that 80 millimeter of mercury of graduated compression, so pressure that is maximum at the foot and then decreasing going toward the surface, is 4 times the pressure performed by the elastic stockings or the compression we usually put there. And it looks like magic because in the water, you don't feel the pressure if you think about that. When you have your stockings on, you feel these 20 millimeter mercury, but you don't feel that when you are having 80 millimeter mercury into the aquatic environment. That is interesting, and we could discuss about this later on. And we could discuss also about the thermal properties, because we know that when we have, for example, an injury, Rob will suggest us to put sometimes cold or hot, depending on the cases, material on us to have a thermal effect. And then there is also the chemical properties of the water, because we could decide to go to the normal pool, or we could decide to go to the seaside, or maybe we could decide to go to a hot spring with different chemical properties. So you understand how much we can play with these extremely valuable tools. So what is your perspective on the application of the hydrotherapy for your patients, Jennifer, considering these properties?
Very, very interesting. I think, what I'm thinking right now, as you speak, I'd really, really love to reintroduce hydrotherapy in my practice, basing on one thing, because we think about putting everything, taking care of a patient as a total person. And I think this would really help, in the circulation of my patient together with the compression therapy. And I would love to hear some tips from you, Sergio, in regards to how can I reintroduce this in the US?
Well, they should just study history. I think the administratives who are responsible for introducing or not this, because as you know, spa, from like the nice spa centers around the world, is coming from ancient Latin, salus per aquam. So in Latin, it means having health through the use of water. It is maybe a little bit of a legend, because even before then, the ancient Romans, there are like testimony of use of the aquatic environment, but it has been said multiple times that in reality the ancient Romans were coming to conquer a region, and in honor of our friends from England, think about Bath in UK, and the first thing they were doing was creating a spa center basically for their health. So in terms of indications to use it, it goes back to the human history to try to fight gravity, as we were saying. Now, the important thing is to do that in an evidence-based way to have real benefits for the patients, meaning that you can just simply go enjoying some aquatic activity without the standardized protocol of exercise, and that's very probably not going to be so useful. We have no data in terms of the benefit of such an approach. Or you can have standardized and reproducible activities that then can be evaluated in a proper way by science. So again, I think it's important to have a look at the evidence-based data and realize the huge potentials you have, because it's like putting 4 compression stockings on at the same time, removing the problem of the compliance. So in terms of aquatic types. That's a very interesting topic we should discuss. Should be hot, should be cold, how deep should the pool be? And the first tips and tricks, since you asked, is to have the patients walking, standing with the water up to the navel, because what you want is a little bit of depth. So more depth more deep it is, the deeper it is, the higher the pressure will be. So don't waste your time learning swimming, just enjoy walking with the water up to your navel. And if you like to do some moonwalk, like Michael Jackson, you can walk backward, and you will move the ankle even more, according to a paper by an author called Dixie. So the first indication is go as soon as you can to the seaside that has a higher density, or to a pool that is validated by standardized exercises protocols, and walk backward, but also forward, of course. So Jennifer, yeah.
So Sergio, yeah, you've been talking about the evidence base for the use of hydrotherapy, and obviously it's been used since ancient times. What I'd like to know, in giving your evidence, in support of hydrotherapy, what studies have you been involved in terms of hydrotherapy, and could you give us a bit insight into those studies?
Sure. I didn't discover anything, first of all, because in reality, you go back to an engineer, for example. That is a nice story, I would say, who was Conrad Jobst, who was having an ulcer, and he was also having a pool. And he discovered that when he was diving into his pool, the ulcer tended to heal. And being an engineer, he was understanding that inside the pool, there was this magic of the gravity force to be removed with the graduated compression. And even before, there were investigations on this topic. So we were already aware of these papers with our research group. And in particular, some nice investigations coming from an author called Ernst, who was already back in the 80s reporting the lower limb volume decrease and the improvement in the venous circulation by diving into the pool. But what we noticed was the lack of standardization of these protocols, because in these papers, basically you could see that every single patient was doing different activity in the water. So if you go, for example, to a spa, they usually tell you to go hot and cold, to walk around, but they don't usually tell you how many repetitions, how many series, what kind of exercise exactly. Now, you might have some benefits doing random activities, but we cannot really measure that, and we need reproducible measures, as I was saying. So in 2017, we published a standardized protocol of exercises targeted to the venous and lymphatic patients, so to give to everybody a protocol that is available for free, that you can use to perform something that we know will lead to a reduction in the lower limb volume of your affected limb. It will increase the ankle range of motion. It will improve the symptoms of your leg. And following to that, we did some other investigations, which we are particularly proud because it has been a real effort to perform such a large studies, randomizing patients in doing aquatic exercises versus dryland exercises. So same exercise into the pool or outside the pool to see the benefits. And in this case, we used a hot spring with a higher density and with mineral components, noticing the even bigger benefit you can have in that, for which I hope that soon you will all join us in the region where we are doing these investigations, because it's a nice region near Venice, but many other hot springs are around the world, like, for example, with our Bulgarian friends during the Vein Week, we will have other moments, of course, also with you, in which we'll brainstorm on this topic, and I invite in this way everybody to join us also for the Bulgarian Vein Week initiative, because Bulgaria is a wonderful country, particularly for the hot springs of this. And you see, a topic we could discuss is hot or cold. There is no real answer about this yet. And we live with a lot of fake news nowadays, because I would like to ask Rob what you think about hot versus cold in terms of muscular benefits. because on my side, for the vascular part, of course, cold is going usually to decrease the caliber of the vessels. But the caliber is just one part. You want the flow, and the flow is dependent by the section of these vessels. So if you want to remove something, sometimes having a bigger cross-sectional area of the vessel could help you removing more liquids. So there are also preliminary evidence suggesting that hot is not as bad as usually is said to our patients who are recommended to stay to stay away from the hot environment. Rob, what do you think about hot and cold? What is your perspective on this?
So I would agree with your parts talking about them, particularly the cold, and sometimes that can affect on almost constricting and closing down, and that can have an effect on then the ability of the individual in the pool of maybe they're not wanting to move as much as well, whereas in a more warmer water, it can help with that more of a relaxing effect for the person, and that they can enjoy what they're doing a bit more, which is one part to then increase potentially compliance and wanting to complete it more, which can have an effect on, obviously, the more they can do something, then the likelihood they'll can get potentially kind of greater benefit from that. But in terms then the water and helping with the muscular or the sensation of that on the muscles particularly can help, as it can become more comfortable for the individual, which sometimes then can allow them to get a greater range of movement, as you're talking about, particularly with the ankle range. And if they're working in the water and they're supported and they're feeling comfortable and warm within that, that can help in terms of then increasing that range of movement, increasing the extensibility of the tissues, the flexibility of those tissues, a little bit more so than if it was very cold and where certain movements would be quite limited because of the effects and the feeling of that, the sensation of that, the cold water.
And sorry, please.
No, sorry, I was
yes.
And so I just wanted to make a brief comment also on the chemical properties, because up to my knowledge, there is just one, but an interesting paper showing how some of the components of the water coming out from the hot springs is actually associated with an improvement in the thrombolytic activity of the blood. So since this coffee and water appointment is for the patients, when we're talking about a thrombolytic activity, means making the blood not coagulating, basically, so making it more fluid. So reducing the risk of what we call thrombosis, so a clot, so a sort of stone you can find along the way of your venous bed. So even the chemical properties could be partially responsible for the benefits you can have from that. But of course, we are scientists, and we have to move from empiricism toward evidence-based science. So I think the main aim of today coffee and water is to dive a little bit more into the evidence-based data of the water, thanks to the wonderful professionalism of the healthcare professionals like Jennifer, who are in the first line in making sure that patients are not simply like little ducks enjoying the water without really understanding what's going on, to the also musculoskeletal system analysis done by a professional like Rob, because you have to consider that the cuff is actually considered by us, specialists of the sector, of the field, as a peripheral heart. So staying inside the aquatic environment is activating your peripheral heart, that is pumping up the blood back to your heart, like if you are in a sort of intensive care unit for your peripheral heart. So it could become extremely important for facilitating the venous drainage that is impaired in more than half of our population, because indeed we are standing up. So we are naturally overwhelmed by the force of gravity.